I'm Gabby Karatka, first semester nursing student. Today's date is 10/17/19, and I will be doing a wet to dry dressing change. 30 minutes prior to doing so, I have assessed my patient's pain level, their comfort, and I've checked the order for the dressing change. So at this time, I'm going to go ahead and perform hand hygiene. And I'm going to go into my patient's room. I'm going to introduce myself and explain the procedure. I'm also going to ask my patient to identify her name and date of birth. And I will then provide for privacy by pulling the curtain. Next, I'm going to take a look at my wound. I'm going to apply clean gloves so I can take off the old dressing. I'll first take off the ABD pad. When doing so, I'll make sure to pull the tape back so then it doesn't fall back on my patient. And I'll take out the old gauze, making sure to count as I go to make sure I have it all. And I'm going to ball this up into my gloves. Dispose of this all into my biohazard trash bag and perform hand hygiene once more. Before doing my new dressing change, I will assess my patient's drainage for the type, color, and any odors that I smell. So now I can go ahead and open up my new kit. And also my sterile gloves. I will apply those at this time. I'm right-handed dominant, so that's the hand I'm going to put in first, using my left hand grasping the cuff. And next I'll put my left hand in. I'll go under the cuff with my right hand. And so now I'm sterile, so I'm going to go ahead and get into my kit. Anything that I don't want to use, I will just dispose of into my trash bag. So at this time I can go ahead and measure my wound, making sure to not touch my sterile gloves to my patient. So it is 10 centimeters by 7 centimeters. So I can go ahead and dispose of this. And I'm going to grab my swabs and clean each side of my wound. I'll use a different swab for each side. And now we'll go ahead and check for tunneling with my cotton tip applicator. So I have tunneling at 11, 12, 1, and 2. And I have some pretty deep tunneling at 7. And I'll make note of that and dispose of that cotton tip applicator. So now I'm going to go ahead and get my gauze soaked in some saline. And I will go ahead and pack the wound now. I'll take one piece of gauze at a time. And I'm going to unfold each gauze piece and ball it up into my hand so I have plenty of control over it while packing. And I'll pack with the cotton tip applicator. I'll just use one more piece of gauze. Dispose of that cotton tip applicator. And now I'll just go ahead and pack where the tunneling is. Dispose of that applicator. And I'll apply my ABD pad with the blue side facing up.
Sorry, I forgot something.
Using my tape, I'll go ahead and make sure that each side is securely taped down. Now that it's down, I'll dispose of my gloves. Make sure that each side is secured. And I will put the date, time, and initials on my wound dressing. Cover that back up. Dispose of all of my leftover materials into the trash bag. Perform hand hygiene once more. And document any other necessary items.